Hey, this is Dr. Zach Watkins, and I wanted to address a question that revolves around how does a functional medicine membership model work? And this is mainly for practitioners who are either implementing functional medicine into their practice or they already have a functional medicine-based practice, because I have seen practitioners who have the model set up, yet there's no, let's say, we call it membership model set up in their practice, which I feel is a disadvantage with a lot of practices. Now, when I say membership model, I don't like the word membership per se, because it gives the impression of like a club or, a country club or a gym or something. But I think for this video, we'll use the word membership just as the catchphrase. And my biggest issue with practitioners not having a functional medicine membership model is kind of a couple-fold. One, patients. Patients, in my experience, they're going to come back after their programs or their care plans is what we call them. And let's say they're either were like 8 weeks or 12 weeks, which is pretty typical. And they'll come back and they may say, let's say they're getting great results. You're a great practitioner, you're a great clinician, you're doing the right labs, you're doing the right, let's say, products. And I think what you're going to find is patients will start to say, well, what's next? What do I do now? And a lot of practitioners that I've come across and mentored and talked to will basically just say, well, take these pills indefinitely. Let's follow up maybe in 6 months, see how you're doing, or message the clinic if you need anything, or, stuff like that. And what you'll find is patients, that it's not a bad thing. They get empowered maybe, but they actually might go somewhere else, because now they're like, well, he or she did their job. Now I'm going to go find something else over here. Maybe a different influencer, maybe another clinic in town that showed me how to, do things for weight loss or whatever. So I think what patients are looking for specifically are going to be leadership. And if you can set up a model that says, hey, you've done well, now let's continue on that path and plug you into our, let's say, maintenance protocol or maintenance plan. What I typically recommend is setting up a maintenance protocol that, in my opinion, you've had lab work, let's say, because lab work are going to tell patients where to go, what to work on. It'll give you some indications about nutrition, any risk factors that pop up. But let's say they finished their program and they did a follow-up lab and you got some data. Well, this gives you reason to say, I want you to fall into our maintenance or membership plan, which let's say it's 3 months or 6 months or even a year. And what we're going to do is we're going to give you more incentives. We're going to give you maybe more discounts on some of the nutritional medicines we use. You're going to get maybe even a higher discount percentage based off of, let's say, different testing you may need. Maybe we'll do clinic-wide special VIP events. I think make it like an elevated experience. In my experience, patients loved it because they didn't have to go out and find someone else to tell them what to do, or if some other problem came up, a lot of times they may not come back to you, they may go somewhere else. Oh, there's an expert down here for this, I'm gonna go over there. So if you keep them engaged, you're going to really be that expert that they can go to. I found it very common and consistently, patients would always want to follow up, doing more lab testing, maybe want to continue pricing or continue purchase of their supplementation they may need. So patients became involved, and it was nice to see because they started taking ownership. So we give them lots of incentives, be a part of the programs, a lot of follow-up, because you are being the leader of them, of their health, and make the questions that they're going to have when it comes to prevention. And I think that's a win. So patient focus is the big benefit. The second one is going to be you, the clinician. And I say this because we take the clinician hat off and put the business hat on. You're running a business. You got to do things that sustain you. You got to sustain your overhead. You got to make money to help other people. So not only are patients going to get well, but now you are going to set up a system that gives you the consistent revenue you're going to need for a business to grow, and actually makes the business more valuable because you have business on the books that can be evaluated to make the business worth more. So now I'm talking like residual, maybe supplement purchases, or maybe they're doing follow-up lab work. If you have other services, let's say chiropractic or IV therapy, injections, where maybe you can bundle all that together, discount it enough that makes it very incentivizing to them, but at the same time gives you that residual monetary benefit. So now you're giving people great service, you're not like stealing from them, you're not raising your prices too much, but you're becoming the leader, the authoritative role in your community, and it gives them opportunity to keep them engaged, which I think is a win for everybody.